Hi, everyone. I am Lourdes, and welcome to the NCMHCE Bible Prep. This session is all about ethics and professional practice. But don't worry, I'm going to keep it real. I'm going to make it easy to digest. No fluff, just what you need to know to pass the exam and to become a confident, ethical counselor. All right, so before we can help anybody, we need to know what we are actually qualified to do. Okay. So that means you must evaluate your training and sticking to your scope of practice. Don't diagnose something you're not trained in that. Remember, you're a counselor, not a medical doctor, not a psychiatrist. So if a client needs something outside your wheelhouse, refer them out. That's ethical, not a failure. And lastly, never stop learning, whether it's supervision, CEUs, or just being open to all feedback. It all counts. And don't try to do trauma work with MDR just because you watch a few TikToks. No, we can't do that. Get trained, stay in your lane, and grow from there. Now, this part comes up a lot in testing, so I'm going to break it down. The statistical aspect. So, reliability, sorry, reliability is, do we get the same results over time? Is it consistent? Right? So if you test for depression, you use the PHQ-9, are you always going to get the same results? Okay? So that's very important. So you have to trust it to give the same results more than once. You know that if you give a specific test, it's supposed to give you the same result, nothing else. Now, validity, there have various different types of validity. Validity is this test measuring what it's supposed to. Okay? So there's content validity, there's construct validity, and criterion validity. Another thing I want to talk about is standard deviation. They're going to test you on this. Standard deviation is how spread out your scores are in respective to the mean. You remember when you started in statistics class? You remember that bell-shaped curve graph? And then the line down the middle is the mean. So that just basically say how close you are to the mean. A low standard deviation means it's a tight cluster. A high standard deviation means it's all over the place. Another thing is p-value. P-value just basically mean is the result random or statistically significant. If we say something is under zero point 0.5, we say that it's most likely real. Now, just a tip. If a test is reliable but not valid, like it doesn't have no validity, is consistently wrong, and that matters. And I know they don't really specifically give us statistic questions. It might be one or two, but maybe you're taking a national counseling exam and you may need to know this also. Now, when it comes to legal and ethical decision making, we have two guidelines to follow. The first is the law. The second is the ACA Code of Conduct, right? So if these two ever conflict, remember the law always wins. It triumphs everything. So you still want to advocate, but you must do it in an ethical manner. And another important thing to do is document the reason why you did what you did. What was the reason why you basically went this route with this particular client? Now, informed consent is just not a signature on a page. It's an ongoing conversation. And informed consent basically says what counseling is, the risks and the benefits of counseling, your role, your approach as a therapy. This is where you talk about confidentiality, the limits, the fees, and the communication rules. So anytime you switch from cognitive behavioral CBT to MEDR, update the consent. Okay. Anytime you go from online therapy to physical therapy, update the consent. Anytime you go from individual therapy to couples counseling or family therapy, update the consent. Also, within the consent, you have to respect the client's autonomy. You don't get to decide. You have to work collaboratively. You let them plan. Another thing I want to stress is age. Children under 18 cannot consent to anything. Therefore, you must involve their guardian. Individuals who are mentally incapacitated cannot consent to anything neither. The only time a child can consent is if they are legally emancipated via the state. Okay, so that's something very important to keep in mind. So if they're under 18 or they're mentally incapacitated, or if they are under the influence or intoxicated, or they have, or they're hallucinating, people that are not in their right state of mind cannot consent to anything. Okay. And electronic communication, this is important. This is always going to be tested. We live in a digital age, especially now after pandemic. And everybody's using technology, but we have to use it ethically. So when you use technology, you need to ensure that it's HIPAA compliant. You have to explain to your clients, because they're going to email you, that email and texting are not 100% private. So every time they contact you in within that same email, write that down. Let them know it's not 100% private. The same way you're going to tell them that in their informed consent. Now, another thing is when you're communicating via email, some clients are going to reach out to you at 2 o'clock in the morning and they're going to tell you they have an emergency. You may not see it until the next morning, and that's okay. This is why you have informed consent, because this is the rules. You're telling them, hey, I'm not on 24/7. Because I'm not on 24/7, I will read your email or respond the next morning. However, ethics. If you happen to be up at 2 o'clock in the morning and you see the email, best to believe it's ethical for you to respond to the client. You say, hey, um, I understand what you're going through. Remember, email communication is not 100% private. However, we discuss in our sessions that if there's an emergency, call 911 or call a crisis hotline, and I will follow up with you in the morning and our next session. That right there is what you need to input in the email if they contact you and you happen to see it 2 o'clock in the morning. However, if you see it you see the email was sent 2 o'clock and you don't see it till 6 or until you get into the office, that's okay. Remember, you always have to think ethically. And one more thing, please, no DMs, no social media convotes. Keep it clean, keep it private. Because if someone sends you a crisis email at 1 a.m., like I mentioned earlier, when you see it, you must respond, but only with emergency referrals and documentation. Now, this is one that gets skipped a lot, and it's actually important because it's a part of our ethical codes. This is about burnout, clinician burnout. And burnout makes you sloppy. So take care of your mind, body, and spirit. Supervision isn't just for intern. Use it to help you process hard cases. Know when you're not okay. If you need a break or referral, own that. And always check in with yourself. Your energy matters. The more whole you are, the more space you can hold for others. So always, always, always put your emotional wellness first. This is tea, and we have to talk about it, okay? This is one of the areas that people slip up. This is, oh, I didn't know, so I'm gonna tell you. So come, real close. The counseling relationship is professional, not personal. No dating, no exes, no friends or families, not even 5 years out, unless it's super clear it won't cause harm to your client. Okay? We have to be mindful of neutrality. If you cannot stay objective, do not take the client. We have an ethical responsibility to refer them out or give them resources. And yes, no social media connections, no liking their posts, no follows, no DMs. You are not their friend, you're their counselor. The relationship you guys are going to share has to be a therapeutic one. Therefore, it has to be sacred. There was a question that was about an individual leaving a review for the client on Google. And the answer was that it was wrong for the counselor to respond, because as a counselor you cannot disclose that that individual is coming to you for counseling, even if the client do it. Remember, it's a sacred space, it's a therapeutic relationship. Therefore, keep in mind, if the client discloses that, no, you have to exercise confidentiality. And another thing about that is, I want to share that when, I don't know how to put it without making it sound crazy. Give me a second. Let me grab my thoughts. Okay, I got it. So, when a friend or a wife or someone reaches out to you on behalf of your client, listen. If there's no release of information, you don't say anything. Your response should be, I cannot confirm or deny if this individual is my client. Okay? Again, I cannot confirm or deny if this individual is my client. Even if they have information that can potentially put someone in danger, you take the information that they're telling you, you say, I cannot confirm or deny. Remember, you cannot share or disclose any information regarding your client without a proper release of information. And if the psychiatrist or PCP contact you and there's no release of information, I cannot confirm, I cannot deny. However, you contact your client and you let them know and you get an informed consent on file. So that's very, very important. This is a good one. We're going to talk about dealing with intoxicated and disruptive clients, and then we're going to end with when confidentiality must be broken. I'm not going to give you 60 minutes of just me talking, because that's what I did in my last video. And I was like, no, even me, I would get bored. But anyway, you're going to have some clients that are going to show up intoxicated. And the ethical thing to do as a clinician is to assess for safety risk. This is where your mental status exam come in. And we are supposed to ensure that they're safe, and we are supposed to reschedule the session. That is ethical. Remember, I mentioned each session, you're supposed to get informed consent. Anyone that's intoxicated cannot get informed consent. So the ethical thing to do would to be to reschedule, ensure that they have a safe way to get home, and assess for risks. Okay? And the most important thing is document. You must document. You have to record the incident and you have to put, how did you respond? Confidentiality is key. Oh, let's talk about handling disruptive um, clients. Basically, the same way. But the most important thing you want to do is stay calm, because remember, you're a clinician. You don't allow clients to take you there or get a reaction out of you, because if they do, that's what you call transference. Okay? Any transference or counter transference and there's disruption going on, maintain your professional composure, set respectful boundaries, and in the session, document and record the incident. That's how you handle disruptive clients. And remember, some clients may not willingly want to come to therapy, especially clients that are, you know, court mandated. Now, confidentiality, this is very, very important. must be broken only when the client plans to have harm themselves. So if they have a plan or if they have intent, you must break confidentiality. They have homicidal ideation, they plan to harm someone else. You have a responsibility to warn the other individual. And if there is suspicion or abuse or neglect to elderly or dependent adults and children, you must report to your state Department of Children and Families, okay? And when there's a court order and is a judge mandated disclosure, you must also break confidentiality. In certain cases, confidentiality has a special aspect, per to say. For example, you're going to get clients that are referred by their employer. And if the supervisor calls, you have to give them minimal disclosure, which means you cannot share content without specific consent. Remember, you have to have a return of a release of information. So, but for EAP, you can only confirm attendance, but nothing private. Family couples, you have to explain that there's limits to it, to family and couple therapy, and you have to get consent from all participants. You have to explain the risks with technology. You have to use HIPAA compliant platforms, okay? Those are the special limits to confidentiality. Another thing is, remember we discussed informed consent? Let's talk about fees and payments because those are agency policies. And this is where you talk about how you're going to structure the sessions, the length, frequency, formats, the cancellation, what to do when they are having an emergency, how you're going to store and keep their records. And remember, when you store their records, it needs to be in a secured, it needs to be like encrypted if it's going to be some technology. And some clients may go through financial hardships. It happens. And when that happens, you have to either provide a sliding scales, right? And another thing is, I want to discuss bartering. Bartering is ethically okay. However, we cannot request it as clinicians. The individual, the client must request, and it have to be if it's ethical, if there's no harm or exploitation, then you must write the agreement, document the terms clearly, and you have to consider if it's culturally appropriate. Okay, there will be an individual that say, hey, I will, clean up your office just to pay for services. Write up a contract and make sure it's not going to harm or exploit the client. Remember, you want to do what's best for the client. Or if you're not willing to accept any bartering, or if it's not your agency policy, again, slide and scale. If not, refer them out. You never drop a client cold turkey. Gift acceptance. You can accept gifts, but they must be small gifts and cultural expressions, modest value items. You should decline expensive items. Please don't accept no earrings from Tiffany's. It's nice, or any cash, but accepting gifts create a obligation and it blurs professional boundaries. Remember, you're there to be their therapist, you're not there to be their friend. And you also need to almost always consider the diagnosis of the individual. And you need to document your decisions and maintain boundaries. There are specific diagnoses like dependent personality disorder. Don't take or accept any gift from them because now they become dependent on you and it blurs the professional relationship that you have. Okay, we made it to the end. This is the last thing I want to discuss, which is your clinical notes. Okay, your process notes are yours. You store those and you keep them safe also. They are not part of the legal record. They are not shared with clients at all. Okay. But you also have to keep these notes safe because remember, it might be some client information. Your job is to ensure that we allow a safe space for them where everything that they discuss is confidential unless you have to be a mandated reporter. Also, your SOAP notes are the client notes, which the insurance usually asks for, the one that has the diagnosis. When you write those notes, they need to be subjective. Subjective, like your opinions is not in it. And remember, clients have access to this record. So write it with very objective language, what you observe, any clinical impressions, and the next steps that are part of your treatment plans. Okay, those are important. And when files are audited, those are the files that they usually typically go for. And when files are audited, of course, contact your client, let them know that they'll be going through an audit. They have a right to deny the audit, but also let them know that that can potentially harm their insurance benefits. And with your SOAP notes, you also want to keep them secured and stored in a facility. You can share client information like SOAP notes with your supervisor, but you have to redact certain identifying information from the notes. Okay. I hope this was helpful. If this helped you, please like, subscribe, leave a comment. If you email me or reach out, I will respond to you. The purpose of this is to kind of help you calm down the noise of all of every information that you have to know or study, but get to the meat so we can discuss how to really start thinking like a clinician. I hope this was helpful. See you again in the next video.